Good morning, everyone. Welcome to today's webinar, Evaluation 101, Empowering Change in African American Communities, Celebrating Black History Month through Data, Impact, and Advocacy. We will be getting started real soon, in about a minute. Okay, good morning again. Welcome everyone to the Louisiana Campaign for Tobacco-Free Living's Empowering People and Community series. Today's webinar is Evaluation 101, Empowering Change in African American Communities, Celebrating Black History Month through Data, Impact, and Advocacy. A little bit about the Louisiana Campaign for Tobacco-Free Living Empowering Community series. The Louisiana Campaign for Tobacco-Free Living, TFL, understands that an essential action of health TFL understands that an essential action of health equity is building the capacity of individuals and communities. Thus, TFL has developed the Empowering People and Community series, EPCS. This series consists of educational events such as this, virtually or hybrid, coordinated by TFL staff featuring stakeholders, guest speakers, partners, etc., from public health policy, medical communities, community advocates, and supporters and subject matter experts to reach professionals and community members from across Louisiana and beyond. The EPCS mission is to equitably bring health, education, resources, and hope to people, populations, and communities. The goal is to increase awareness and empower people, populations, and communities about tobacco and tobacco-related concerns or tobacco-related and non-health health disparities. Here are our learning objectives. I'll let you all take a moment to read. I am Michelle Oza. I'll be your moderator today. I am the Social and Health Disparities Senior Coordinator for the Louisiana Campaign for Tobacco-Free Living, a program of the Louisiana Public Health Institute and the Louisiana Cancer Research Center. Our lovely panelist for today is Dr. Nia Davis with Racial Equity, Social Impact, and Strategy Consultant, Jana Beers, the founder and principal of Freedom, and then Sterling Fulton, the Director of Training and Evaluation at the Center for Black Health and Equity. Our first speaker today, this morning, will be Dr. Nia Davis. She's a native of New Orleans, Louisiana. Nia received her bachelor's degree from Louisiana State University and a master's degree in health promotion from the University of New Orleans. Nia received her training as a culturally responsive evaluator from the Graduate Education Diversity Internship, GEDI, of the American Evaluation Association. She also obtained a Doctor of Philosophy degree in Executive Leadership from the University of Holy Cross. As a lifelong and third-generation social change agent, Nia brings her equity and justice persona to her professional and service activities. As a researcher, instructor, and leader, Nia has contributed to the public health, nonprofit leadership, and entrepreneurship project and initiatives. She has served 10 colleges and universities in various leadership, teaching, and research capacities. In addition to her work in academia, Nia serves as social impact, strategy, and measurement consultant and leadership coach through her firm, Purposeful Solutions, LLC. She is an unapologetic advocate for closing the racial equity gap for BIPOC communities. In her spare time, she serves as board secretary at Excel Primary Health Centers, a federally qualified community health center, and board president of People's Housing Plus and affordable housing and community and economic development nonprofit organization. I'll now stop sharing my screen so that Dr. Nia Davis can present.
Thank you so much, Michelle. I'm very excited to be here and be joining this phenomenal group of panelists on a subject that is very near and dear to my heart. As you will know, I'm a New Orleans native. And so for those, we'll be talking today about the role of culture and cultural responsiveness in terms of program evaluations and the work that we do. And so an example of that is if I were to tell you that I'm on my way to make groceries and I'm going to pick up cold drinks because I'm meeting my family and friends for a Mardi Gras parade, and we're going to be on a corner of St. Charles and Melpomene, standing in the neutral ground. People in New Orleans will know exactly what I mean when I say that. But those outside of New Orleans who are not quite familiar with our culture might struggle to understand what exactly is Melpomene, what is a neutral ground, and where is it, and what does it mean? Cold drink. And also, if I said I'm making groceries, what does that entail? And so that sort of paints a picture of the need for cultural responsiveness, understanding the cultural context around program evaluations. It's also about data and its usage and social impact. And so allow me to share my screen as I go through a few slides for us to discuss this today. All right. And so exactly what is culture? Well, the reality is culture is a collection of learned and shared standards, values, customs, beliefs that's common to a particular group of people or society. Your family could have a culture. You could grow up in a culture where there's a matriarch who sort of runs the show. And that could be the big sister, that could be the big mama, the grandmother, the great auntie, or there's a parent, right? And there may be customs around that. It could be in your city, it could be in your neighborhood. So culture is all around us every day, and it makes us who we are. And so to that end, then certainly we must also be sure to include culture in the work that we do around data and impact, right? And so I've been trained, and I've for the last 20 years been involved in utilizing a framework for evaluation known as cultural responsive evaluation, also known as CRE. And so when you're doing evaluation, you certainly want to do that to examine the impact and look through the lenses in which culture and the culture of participants is considered to be an important factor. And so what CRE does is it incorporates that and it honors that in the culture in which evaluation takes place. And part of that, those components include the inclusion of multi-ethnic evaluation teams. Very often, I am one of a few of evaluators in the room who do program evaluation. And that's part of the uh, uh, supremacy culture, also the prevalence of in academia. So if we think about white patriarchy, it's uh, the large uh, majority of those who are participating in that or present in that, then you understand the need to have a multi-ethnic evaluation team and the benefit of that brings to evaluation and data and the impact of data. Also, CRE helps to incorporate and engage stakeholders. You are essentially centering the voice and the lived experiences of those who are um, who are stakeholders in this work. Also, it does utilize very heavily qualitative data techniques, right? And so it doesn't focus solely on the numbers, but also using tools for qualitative data collection. So using focus groups, having observations, interviews, assist in making sure that there's cultural competence and relevance and context within the roles of evaluation. It also allows for data disaggregation. So let's separate the data out and utilize and see what it means for different people of different groups, including ethnicity, not only just age and gender, but ethnicity as well. And as I mentioned, it centers the voices of those who are involved. In particular, my work centers around not only cultural responsive evaluation, but also building evaluation capacity. And that's basically sort of strengthening the muscles for individuals and organizations around evaluation, its usage, its benefits, its utility, and with the power that data and evaluation can have in terms of impact and telling our story. And so these things involved, uh, highlighting the use and utility of evaluation as a learning tool. Very often, I might walk into a situation where people are very anxious around data and impact and evaluation. Why? Because it's been used to weaponize our communities, right? And so there's a legitimate anxiety around what actually this is being used for, right? And so I take on my evaluation capacity building hat to be able to address these anxieties, to address the punitive responses that have been happening or even being thought of in terms of evaluation results. I'll I often have people say, "Oh, well, we're a little anxious because we don't know if our funder is going to pull our funds." Well, evaluation is a learning tool, and so if your funder is going to pull your funds around you utilizing a learning tool and learn from the work you're doing, then maybe that's not the best fund to have as your partner to begin with. And so I use an evaluation capacity to be able to help coach and encourage program leaders and participants around these things. And that can include coaching, it can include consulting. I always say it comes with the NIA package. And so I'm a natural educator, I'm a natural coach. And so those conversations are going to happen throughout the process, whether it's going to be through a formal workshop or seminar, or if it's going to be in a one-on-one sort of discussion around the design and planning and execution of this work. And so the benefits of um, improving and strengthening evaluation capacity building is one, it increases participant voice. I was recently in a room, and this was not my project at all, but it was a project where people and participants were asked to sit on a panel and share their experience. And 2 out of the 3 participants in their response said, "We're tired of surveys. Everybody's sticking a survey in our face. We're tired of filling out surveys. Why are y'all sitting this person? You always want the numbers. That's all you want." And so the leader in that room made a decision to say, "Okay, you know what? We're not going to do surveys anymore. We're going to find another way to engage participants and get their feedback and their understanding and not necessarily do evaluation and do surveys." And so evaluation capacity building then will allow you to have that increased participant voice, right? Not people being able to express themselves in their own voice, as opposed to having to choose from a particular prompt or answer a particular question that might not really be reflective of their experiences or their perceptions or thoughts around those things. Evaluation capacity will also help improve data accuracy. So when you are engaging stakeholders and you are showing data, and as you are absorbing the data, then what's the thinking? What's your interpretation? What does this mean to you? And so that is part of a capacity building. It also increases sustainability. The more equipped that people are around data, how it can be used as a learning tool, how they can utilize their voice and sharing the impact and telling the story of their work, the more likely it is to continue on even after this particular project might come to an end. And so, in terms of inclusion strategies, as I shared before, you want to center and include those who are most impacted by the program and its goals. If you're looking at the life cycle, you're looking at your logic model. Why did you create this program or project? Okay, well then these people need to be part of this entire process, including the evaluation. You also want to create multiple opportunities for inclusion, implementation, um, interpretation, and analysis. So, uh, you're going above and beyond, not just have meetings during the day, meetings in the afternoons that will allow all participants to attend. You're bringing people in for data collection or interpretation. Here in New Orleans, it's a given now. It took a while, but it's a given now. You provide something for people to eat. You don't understand people's circumstances, and it's also part of our Southern hospitality. So it's not that far fetched, but always providing something for someone to eat because you're asking for their time. You're not quite certain what their circumstances. They may be sacrificing dinner or the what they can provide for their family in order to be there. So you want to be accommodating as possible. You also want to utilize the culturally appropriate data collection tools and report and disseminate findings in a way that's accessible and in accessible formats. And so with that, I want to thank you for your time here today. And I'm very excited about hearing the rest of the panel as we continue on this journey of the strength of what data can do to highlight our successes as a learning tool to be able to utilize that and how we can actually leverage that in terms of growth and in reaching our collective impact as those of us who are involved in health equity, social change, and collective progress.
Thank you, Dr. Nia Davis, for that. That was very informative, very informational. Well, now we'll have Jana Burns with Freedom Consulting and Facilitation, LLC. She will now come up next to give us her take on evaluation and all the work that she does. I will now turn it over to you, Jana.
All right. All right. All right. Okay. Let me make sure, because I have grace for all things technology and humanity in these times that we are in. Do you see my screen? All right. All right. So thank you, Dr. Nia Davis. Set me up. I'm so glad you touched on some things. I'm going to be very transparent with you all. My work comes from more of deepening the understanding around the why. I'm also very passionate about this, so I might talk a little fast. Please have grace for me. There's never enough time to talk about the right things. There wasn't a bio shared about me, but I am hitting my 25th year in public health right now, most of which was spent in the communities of Durham, North Carolina. I live in Michigan now, following my purpose, and now work across the country as a consultant and also a coach as well. and specifically coaching around transformation and what that looks like both inside and outside of our institutions, because we are part of the communities. We are extensions of the communities we serve, and some of us have lived in those communities. I lived in the communities that I worked in Durham, North Carolina for 16 years. So this work is more than just a job for me. It is my life's purpose. It is my commitment. And it's not something I do from a 9 to 5 or on, at certain times. It is literally my lens. So I just want to share that. If you want to learn more about me, you can check me out on LinkedIn, and hopefully you'll get my slides after this where you can learn more about me and my purpose around freedom. The word freedom is very much on purpose. Happy Black History Month, y'all. As you can see, I have the Black Liberation colors. This is very intentional. And so if you want to learn more about me, you can also reach out to me. I talk to everyone as long as my capacity allows. I want to set us up, though, about talking about power. Quick update. Check this website, and it is now down. Y'all know what's going on. I won't spend tons of time there, but I will say that for a long time as a community health educator, I used the 10 essential public health services, which were released in 1993, the first version. In 2020, this new version popped up, and there was a lot of participatory work around getting this redone and revised. Equity's at the center. I have 2 things circled on here: investigating, diagnosing, and addressing health hazards at the root causes. We talk about the root, but we don't tell the truth about the root. I do, because I feel like the truth will set us free, hence the name Freedom. Also, because I was a community health educator that always had to have a shoestring budget and leverage resources, I always came back to the CDC's recommendation that we should be strengthening, supporting, and mobilizing communities and partnerships. I lived in one of the worst health zip codes in Durham, North Carolina, and when I started overlaying the redlining maps with disparity maps, they were very similar to me, and that became problematic as I was also an organizer in the communities that I worked in, and I was a health educator who wore a badge. So I was a gatekeeper, and I had to understand that. Now, when we think about equity, we often talk about it as that outcome where everyone has a fair and just an opportunity to achieve optimal health and well-being, right? We're not going to get there unless we change our practices, policies, programs, procedures, all the P words. And so I do look at equity as a process of actively promoting policies and systems and community conditions that enable optimal health, also removing to remove the systemic and structural barriers and being honest about that. And so when we think about equity as a process, it requires us to reimagine and also relinquish some of our power that we have in institutions and redistribute it with the understanding that communities been taking care of themselves for a long time. My work is built off the work of Dr. Kamara Jones, who I've been following for the last 25 years of my life across this country. Her definition of racism as a system of structuring opportunity and assigning value was very powerful for me when I heard her keynote at the UNC Minority Health Conference in 2003. I was 23 years old. I didn't understand how to articulate what she was putting down, but I was ready to pick it up. And I've been on this journey of curiosity, most of my work focusing on the intersection of race and gender, specifically Black women, as Black women have raised me and are my colleagues, friends, and neighbors. So it was very important that we were telling the truth about, our disparities, which for me started in my exercise science program, where I learned that the whole entire program was very oppressive and very inaccurate as far as African-American culture, all the things that Dr. Davis just named about cultural relevancy. There's no cultural creativity in any of it, no creation by cultures. It was really, when we think about evidence-based, for who, by who, and that's a question I always invite people to reflect on. Dr. Kamara Jones' definition talks about advantage, unfairly disadvantaging some communities and unfairly advantaging others at the same stroke. So there's something happening to either side that often stays invisible. She talks about many types of racism. I'm focusing on structural institution today, and most of my work is focused on the structural piece. However, I'm very passionate about internalized racism and oppression because it has impacted me largely, and it impacts our people as a whole, and not just here, but as a global phenomenon. Anti-Blackness is very real, so I want to name that. As I continued working in communities like Durham, North Carolina, which is historically Black and has a long history, I can't even get into that, but because of that history I had there, and as Dr. Davis said, understanding the stories, the history in these places is very important. But as I continued to work, I started to build up this other definition in alignment with Dr. Kamara Jones when we started looking at power. And when we think about power and the system of advantage for those considered white, with the understanding that white is a construct that we did not create, and of oppression for those who are not considered white, it is a white supremacy system. Now, I do workshops all over. Doing them in Michigan in the last 5 years has been very interesting. Yeah, because I had a lot of bias about the South versus the North and Midwest, and I really was obsessed with the Great Migration. Very interesting the way people's mindsets are up here, and it really challenged me a lot. But when you say the word white supremacy, it can get uncomfortable for folks. But I want to just show us a visual of, I'm a visual person. I'm a creative by heart. I'm a health educator. I always had to talk about chronic diseases in a way that was that people would want to listen. And so I like to build visuals to show what I'm talking about when I say a system of advantage, social, institutional, political, economic power, white supremacy system. Now, I want to say I don't know what these people on this screen identify as, but as Dr. Kamara Jones says, social interpretation. And by my interpretation, most of these men are white. And I know that this landscape has changed a little at the end. We've got Obama down here, but this is a legacy that's been created. I just want to name that when we talk about white supremacy system, this is the highest seat of power. That's the presidency. And then we've got the vice presidency. And then we've got who controls our institution. So there's a lot of patterns that start emerging when we look at power. And those patterns of power are what we need to be paying attention to, both historically and currently, because those constructed roots have created our current reality. Dr. Kamara Jones says the present is not disconnected from the past. So if we were just approaching our solutions or our problems from where we are right now, we aren't going deep enough. We need to swim beyond the surface because this is not by happenstance. I got into public health because I watched my grandfather die from diabetes. He lost his eyesight, he lost his limbs, and he was the strongest man I'd ever known. Diabetes is preventable. And as we talked about diabetes in Black communities, it was really unnerving and frustrating to me that we talked about it as a destination. Well, you know, you're Black. That's a risk factor. Is it? I started questioning that at about 17 years old. I went to college in 1997 at 17 years old, and I entered the field of exercise science, as I said earlier. And the first thing I learned is that Black women had the highest disparities in obesity. And we started blaming and shaming people instead of naming power. We didn't talk about stress that comes with race and gender. We didn't talk about the barriers and the burnout. We didn't talk about weathering. We didn't talk about working multiple jobs. We didn't talk about many things that really lend to the conditions in which we are currently dealing with. And they've only worsened over the last 25 years of my career. And so as I started thinking about my organizing work and learning about these different events on your screen right now, this is one of my activities in my workshops. I could do a whole conference on this, but this is just a snapshot that I use in activity. It's about an hour long, and I have teams go and do a Google search. Freedom ain't free, but Google is. And I'll have them go and come back and they'll answer some questions. Okay, so we would name what each of these things mean. Who's being advantaged and who's disadvantaged was the biggest two questions that everyone had to answer. And I see the same patterns, same answers coming up over and over the last decade with this one snapshot. And so my goal is really looking at the patterns of power by asking who's being advantaged and who's being disadvantaged, because that then becomes power versus oppression. And one thing that's very clear to me from not just my degree, I have 3 degrees, but it's been the books that I've read by Black authors, the research that's been created by Black women, shoulders that I stand on that have supplemented my degree programs and curriculums that were never created for me to see all of this, what I see, right? And so I had to dismantle a lot of things in myself and do my own learning. There's a reason why books are banned. This country was founded on land stolen from its people who were stewarding the land, not owning it. So think about land ownership and where that comes from. People stolen from their land, and I just got back from a few weeks in Ghana last month, and that was just very powerful. Learn like all the connections I'm making. People stolen from their land and then exploited for free labor, and then the laws that kept this arrangement in place. Every one of these events, laws, policies, and there's so many more I could add, and it goes on and on and on, beyond and before this timeline. And what I call this is the legacy of lockout. We don't learn it in this way, but when you look at it. When you ask who's being advantaged, there's a compilation of power to one side and a compilation of disadvantage, which then becomes oppression. So when you layer those two definitions that I share with you, this is what it looks like. This is a snapshot of how it started. These are the roots. And this is the chain we carry with us. This has then created this human hierarchy that again is invisible, but it's very real when you start asking different questions. And not only does that human hierarchy exist within society, but it shows up in our data. I could take this racial wealth gap slide out and add any other one in there, and it'll still look very similar because the patterns of power are again patterns. So there's patterns that are coming up just by default. As we go on past that timeline, another thing that really unnerves me when we're thinking about how we disseminate data and how we're even looking at data in our communities is that we don't even know that national government sanctioned housing policies created segregated communities across the country. And while each neighborhood or community may have different nuances, there's national policies that blanket this. So there are many different policies that locked out African Americans from owning home, and home ownership in this country is how you build wealth. So the racial wealth gap is not surprising, but when we think about social determinants, and I call them contributions to health, we also need to understand how those came to be. How did those community conditions come to be? And these are just some of the laws and racial covenants and redlining and some, but there's more. And I will be honest, if you start looking at racial covenants in some neighborhoods today, they still exist. And they say no Black folks, no Native Americans, no mulattoes. No, they have all these people of color listed in some of these racial restrictions. When you look at them, you have to seek them out. You have to look for them. This right here is Highway 147. There is a highway in Louisiana. I visited when I went there. Whenever I go anywhere, I want to know where the highway is. The Federal Highway Act provided 90% of funds for highway construction for all those folks that were allowed to buy those homes out in the suburbs to connect them back into the inner city. And now we see a reverse of that with gentrification also happening across the country. So who gets to decide which areas are valuable and which are not? And I wrote on this for, again, 16 years, understanding that it broke down Hayti, which was a Black community in Durham, still people thriving and still certain institutions still there, but they were promised one thing and an opposite thing happened. And so we can't just blame and shame Black and brown folks for the way that their communities look without understanding there's more to it. And this also has led to Black Americans being more likely to live near landfills, more likely to die from exposure of air pollutants. Generations of Black women in poisoned communities with irreparable harm to their uteruses. Y'all, it's daunting, right? I understand that, and I want to name that right now. I have spent years, my whole career, building and checking in on this data because I have been speaking this for a long time. I've also been pushed out of every organization I've ever worked in because of it. And the thing is, I'm never going to be quiet. Because if we continue to be quiet, I just can't. It's a responsibility for me. And we talk about the healthcare system, but every single system, sector, and social determinant of health has racial inequities. So we spend more time in our communities, and we need to understand this, that these policies pushed Black folks into these areas. And on top of that, we have very overcrowded areas and oversaturation of poverty in Black and brown communities, but there is no oversaturation of white poverty. And I just want to name that. That's something I've been following as well. So in the end, racial inequities are systemic, patterned, unjust, avoidable, and actionable. They exist across every system. We call them something different. This is inspired by the Racial Equity Institute. Again, I'm a visual person. We name them something different across every single system that keeps them invisible. In reality, we should be looking at them in a systemic way because all of these things impact our health and well-being. I've been using this slide for about a decade. Sometimes I just pull it out and just show it to people and ask them, where are we? Because we know this. We know this very well. But we also know there's communities that have green trees and grass and sidewalks, and there's a difference between the tale of two cities is what we started saying in 2010, which was very unnerving because why do we have two cities? Why is that? Let's ask why. And so I started thinking about this as the crab in the barrel metaphor. I won't get into this. This is a capstone project I did for my master's in social justice and community organizing. I didn't need that degree, but people were telling me I didn't know what I was talking about. So I gave in and did it just so I could be credible. But as I started thinking about the barrel is man-made. And when I was doing a lot of work around mass incarceration is literally a problem for Black and brown folks in this country. But there are many other prison sentences by another name. And they are created by the way that our communities have an oversaturation of fast food restaurants, payday loan play. All of these things are literally prison sentences that people cannot get out of. Chronic stress, chronic disease, medication. My mom's been on 3 medications for most of her life. She is 84 years old. She is still here. She was born in 1940. So just to give you an idea of who I was raised by. And I have two older sisters, my great aunt and my grandma. I'm really blessed to have been raised by Black women, and that's where most of my education has come from. That's gotten me where I am right now. But I just want to name these things are happening, and if we don't understand this, how are we looking at data and how are we looking at disparities and who are we blaming for those? We often say, oh, we're not making the right choices, but I think people make choices based on what they have available. All right. And so what we do know is that power imbalance is creating this oppression and it's creating the tale of two different cities, but we know thriving communities exist. Who's in those communities and how did they get there? And so us not asking those questions, it doesn't make sense because scarcity is a false narrative. We have all we need to be free. We just have power hoarding issues and gatekeeping issues in our institutions and beyond. And so when we're looking, I was so glad Dr. Nia Davis said disaggregate. Why are we still putting out data without disaggregating? It's beyond me. I think when we do that, it makes us more comfortable, and comfortable for who? When we say the tale of two different cities, that's code. That's code for, that's code for catering to comfort and who. On the right, when we look at this disaggregated data, it tells us, okay, these are the disparities, observable and measurable. Why? And so if we are not saying why, y'all, we are allowing people to come up with their own ideas that are swimming in bias, false narratives, and stereotypes, quite frankly. And if we are not naming the why on this data, then people will continue to believe what they want about these gaps. And who are they blaming? This was just put out on CNN, November 2024. Certain ethnic groups are also more likely to have type 2 diabetes, including African Americans, et cetera, et cetera, et cetera. There is no why. There is no mention of the communities and the policies and the legacy of lockout that we are existing in, none. So whose stories are missing? What are we telling with our statistics, right? I tell people all the time, I came with the stories before the statistics. I had the narratives before the numbers. There are people on the other end of this data for me. And so we got to be more thorough. We claim racism is a public health crisis. I often say it's also a public health practice. I won't spend tons of time here, but we literally perpetuate this very thing, dominant culture within our organization. This is what I call the box of bureaucracy, the box we continue to check, the table everybody's trying to sit at that will never fit everyone. This is really focusing on production, profit, and power over people. And while there is social, economic, and political power, there's also power in people, because if there wasn't, I wouldn't be here right now. And if we want to get to a place of transformation, it requires truth and transparency to build trust. You cannot go into communities without this understanding. You cannot even move forward with data if you are not having the truth and transparency, if you are just watching over it. And so I want to introduce this tool that you can use. But I'm not going to spend tons of time going through it because you can read it for yourself. But I wanted to spend time with the why, because that's the part that's often missing. We know how to do it. We toolkit and framework ourselves all over the place. I don't know how many more toolkits and frameworks we could use, but I wanted to make sure that we were really deep in the why. And so now you know why we need to do this in this way, because there's a lot of us that don't have this information. We have parallel experiences in this country. Yes, humanity, human race is the only race. However, race as a construct has influenced our cultures. So depending on your racial and social identities and your proximity to oppression, your experience will be different. Now, who can use this tool? Everybody. Okay, we got community folks, institutional spaces, practitioners, advocates, and also healthcare systems, public health departments. Really, anyone can use this. I love the tool. I worked with this group for a few years. It was a Community Innovations for Racial Equity project, connecting healthcare organizations with community activists and leaders, and building those bridges so that they could bring their power together, because there's different power, but we're moving in parallel. So why don't we come together and share our gifts? Overall, data is power. It shapes the way that we make sense of and engage the world. I won't spend tons of time here, but we know that data frames what is believed and who is believed, and then what actions we take. The data we collect is important around powering the shape of our future and our communities, right? So we need to start from a deep place of rootedness and truth. Historically, we tend to leave excluded members from minoritized groups out of these collections because we feel like we have the expertise, but we are only experts in our own experience. And traditionally, when we have outsiders make decisions, they fail to recognize this invaluable lived experience. Lived experiences was also mentioned earlier before me, and I think that's really important. It's also a tenet of Black feminist theory, which is I'm a student of. So while everyone's talking about that, that now. That's been in discussion for many, many, many years. And I just want to name that because I'm always going to cite Black women. So really important to think about who is part of the data collection and then how we disseminate it. I wanted to share Louisiana had a couple of groups in this cohort, and there was a couple of quotes from Louisiana that I wanted to share in this, that collecting our own data helps our organization counter the narrative of what is perceived about the community. We often work in deficit-based approaches when we should be thinking about assets and gifts, even if we don't value those or we don't understand those. That's why building those bridges are so important. We are nestled within the lower ninth ward of Louisiana, and the common narrative, if you didn't live here, it would be negative. With our own data, we can fight those false narratives. And I think that is really important, and I wanted to highlight that. This tool has 4 main things throughout it. That's ensuring the community is at the table. And I think a lot of this was already covered, so I won't spend tons of time, but we're thinking about community actively involved in the process, not just having a seat, because just because you get a seat don't mean you get to eat. And I keep saying that. I've sat at many tables and looked around and didn't have no plate and no utensils. Okay. Number 2, getting clear on goals and impact. I love great intentions. They're beautiful, but they don't always relate and transform into or translate into positive impact. Impact over intentions every time. Exploring strategies that fit your context. I just shared this whole national thing, but you can take that a step lower. Like Dr. Davis said, what is the culture? What is the history? How did we get here? What is it in these specific places? And you can build on that. And then maximizing community power and advancing equity, empowering communities. Sustainability is so important. And when people are part of this, and here's the thing, people who have their problems and their pain are also they're closest to their solutions and their joy. We're just not listening. Another group in Louisiana said that we intentionally engage communities through ongoing dialogue, conversations, and impact surveys. So that qualitative data, yes, yes, yes. It's so important to foster these deep community connections, also about building relationships. Relationships are revolutionary. To involve community members from the beginning all the way to the end, that was already said. I wanted to give you a quick example, but I know I'm running out of time. I won't spend tons of time on background here, but in Durham, North Carolina, affordable housing became #1 on our community health assessment. I had been part of this for a decade. I was part of this partnership, and at this time, I was the co-chair of the overall partnership. I challenge us to be honest and to change our subcommittees to reflect what the community health assessment was saying they needed. If racism and discrimination were number 6, I asked everyone, let's look at how that shows up in the top 5 issues. So I was challenging us, and I got in a lot of trouble about it, but we were able to push some things through. So when we put our data out, we didn't just put it out that the disparities exist. We put why. We put that owning a home is a key contributor to increasing household wealth, but that historical and current policies have prevented folks from doing that. For poverty, which had already been an issue in our community health assessment for a long time, we used the word forced generational poverty. Got a lot of pushback on that from our leadership, absolutely. But we had to be said. We also named how much each of these things were. We weren't just putting data out. We were putting the how, the what, the why. We were adding a little bit more context. And then with obesity, diabetes, and food access, which was my forte for the whole time I was at the health department, forced people of color to live in neighborhoods where it's harder to access. We were naming these things. We gave people sites. We put this out in many different ways, and we did listening sessions. So it wasn't just surveys, because yes, being in a place with Duke University and UNC, prestigious colleges, and also large healthcare systems, the extraction was so very real. And I wanted to just say another thing that's really important, and I like this quote, is that at Community Voice, we use data storytelling to blend story and data so people can better understand the meaning of the data and move towards action. Well, another thing that we did during this time is when we did those listening sessions, and I facilitated a lot of them, we had food, we had childcare, we held them at all kinds of times, early in the morning, late at night. I was volunteering to do it because, again, I lived in these communities. We put back out, we heard you. We also tied some of these ideas to actual action plans of the subcommittees for the partnership. So now we're working on these for the next 3 years. And so it wasn't just we did something and we're done. We actually wanted to work on improving these things and putting it out that, yes, we want to be accountable to you, the community. I've never been accountable to people in offices overlooking the city. It's always been to the people in community. And last, I'll just end that until the lions have their own historians, the history of the hunt will always glorify the hunter. Until we can flip the cup and mix it up and get people like me who have never been promoted and never been able to move up in their career for whatever reasons, gatekeeping and power hoarding, and because I speak truth. Until we can start getting our community members in with the work that we're doing, we're never going to make the change that we say we're dismantling, that we say we're trying to do. And so I often say, let the lions lead, because when we think about who the hunter is and we think about the history in this country, I think y'all can answer that without me saying it. All right, I know it was a lot, y'all. Okay, I'm done. And that's one of my favorite African proverbs right there. I have many quotes. But thank you for listening, and hopefully you'll get some more deep exploration when the slides are shared with you.
Thank you, Jana. Thank you. Thank you. That was very powerful. I love that. I love when you speak. It's always great. We're now going to move on.
I've got to follow her.
Yeah.
You were amazing. I've got to follow you. All right. I'm going to try. All right. I'm sorry, Michelle.
No, you're good. We're starting with Miss Sterling Fulton. She's Director of Training Evaluation for the Center for Black Health and Equity. And I will now turn it on to you, Miss Fulton.
Yes, hi. My name is Sterling Fulton, and I work for the Center for Black Health and Equity, and we are dedicated to saving Black lives. We've been working deep in the fight against mentholated cigarettes since our founding in 2000. So in the chat, I want you to monitor that chat, because I'm going to put some links for some tools and resources that I think you're going to find very helpful. Okay. So what I want to do today is, next slide, please. I want to explore how equitable evaluation can empower our tobacco control efforts. Equitable evaluation focuses on that power shift, and you heard a lot about that today. In communities, ensuring that those that are most impacted by systemic inequities are central to the decision making. It incorporates cultural, structural, historical, contextual, and geographic factors to create evaluations that are not just effective, but also inclusive. And all of those points are very, very important. So I want to start off by kind of level setting, discussing the historical roots of data collection, the role of community storytelling, and actionable strategies for ensuring that you can infuse equity in your evaluations. So again, this isn't just about collecting data. It's about driving meaningful change. All right, so let's start by reclaiming data collection. Next slide, please. Oh, no, slide before that. Yes. All right. So what you're looking at here is one of the first evidences of evaluation. And it's a bone. And it's a bone that's 40,000 years old. And this bone was found in a mountain in a cave in southern Africa. And there are notches on the bone. And this isn't by happenstance. These notches, there are multiple examples of bones like these. They've even found bones that are older. And what that is it shows that data collection has deep historical roots. The Limbobo bone, it's the earliest known mathematical artifact, and it dates back 40,000 years. It is ancient. And like I said, they're finding others that they think are even older. So it represents our long-standing commitment to tracking, measuring, and evaluating. In the context of modern tobacco control, it reminds us of the ability to gather and analyze data. It's critical and it's crucial to understanding and addressing these systemic inequities that we've talked about. And one of the biggest systemic inequities that we can actually work together to change is that target marketing of mentholated products in our communities. Okay, so it's important to keep in mind that tools like these weren't just about numbers, but it was about decision makings. It was about resource allocation. Essentially, those early evaluation methods were critical. It's important. And I want us to reclaim that. Often when we talk about evaluation, the first thing that pops up into mind is, the Greeks or, Western evaluation methods. No, 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 no. We've been evaluating way longer than that. We've been using those methods way longer than that. So I want us to stop saying that and to reclaim it and bring it back home to where it belongs. Okay, next slide, please. Next slide, please. So data without stories is just numbers. For example, during the push for menthol bans, it was the compelling narratives about the predatory marketing of mentholated cigarettes to African American communities that helped policymakers understand the lived experience behind those statistics. It's a combination of that data and storytelling that drove the policy change in several jurisdictions all across the United States. Stories help give context and humanity to the numbers, making them relatable and making them actionable. For example, African American communities face disproportionate tobacco-related harms due to systemic inequities and that target marketing. We know that. We saw those images and we saw those images. We walk into those neighborhoods. What's more powerful is the stories that are behind it. The facts are powerful, but pairing those facts with stories on how those inequities manifest themselves in daily life is what drives real change. Next slide, please. So tobacco control just isn't a health issue. It's a social justice issue. For decades, again, the tobacco industry has been targeting us, particularly through mentholated tobacco products. African Americans are exposed to 10 times more menthol tobacco advertisements than their white counterparts. And as a result, over 80% of us smoke mentholated cigarettes. So why? And this just doesn't happen by happenstance. In African American neighborhoods, we have our social, our educational lives, from the Cool Jazz Fest or the Newport Jazz Fest to scholarships at HBCUs to media. You've got Jet Magazine, you've got Ebony Magazine, you've got billboards. Those all have been heavily targeted with mentholated ads. And these targeted efforts have led to devastating health outcomes, including higher rates of tobacco-related illnesses. Next slide, please. So, and as Dr. Davis and Jana has said, equitable evaluation ensures that the voices of those most affected are centered into the process. But implementing equitable evaluation, it can be challenging. So one significant barrier is reaching the right people. And that's hard. I mean, how do you reach those people who are on the ground, who are actually using the products? How do you reach those people that are actually needing your services? Well, one of the things that we commonly do is we engage HBCUs. Well, I argue that maybe to achieve a greater impact is going directly to other community hubs like neighborhood barbershops or beauty salons, or actually even directly to employer groups. Even churches, one of the mainstays of our community. Sometimes I think the emphasis on going to the church isn't reaching necessarily the people that you need to reach. So if you have to step out of your comfort zone and go to these non-traditional venues, those venues where people congregate together who are tending to be or to reach your demographic group, you may have to do that. These specific methods also asking those people, the people who are actually the users or the smokers of tobacco, bringing them on board, bringing them to that table and asking them to help you co-create your evaluation tools. It help you not just by listening, not just participating in those focus groups or in those listening sessions, but actually having those people, hey, are we asking the right questions? Are we actually doing what it is that you need us to do? And So that evaluation is about shifting, equitable evaluation is about shifting power to communities to really help address those systemic inequities. Okay. Next slide, please. So, data is that secret flavoring that is used in decision making, and it helps us to identify patterns and measure progress and make informed decisions. But, for data to be valuable, it has to be actionable, it has to be credible, and it has to be community centered. Disaggregating data, and I know we've talked about this several times today, so I'm going to say the same thing that you've already heard. By race and geography, it often reveals these hidden inequities, such as higher smoking rates in underserved Black communities. But I'm telling you something, guys. I'm going to give you a little secret that's going to really help you when you're looking at your data. When we prioritize actionable and community-driven data, we create the foundation for policies and programs that truly address health disparities. So there is a website called CDC Places, and I actually use it quite a bit. It is when you use CDC Places, and I'm going to put the link to that in the chat, along with the US Census, you are looking at data which you can use to inform and create the baseline for a lot of your work. And this will actually show you your powers of data. Your CDC Places data shows you your health disparities. It also shows you your social data. It shows you health inequities, your social determinants of health, all in this one. Actually, I call it my little hidden gem. So I am going to put the link to that in the chat so that you can see it right there. Actually, I should wait to the end because I don't want you to go to it right now. But if you don't mind, let me finish and then click on CDC Places, because I tell you, you're going to be playing around with that thing. You're going to love it. Okay. But don't stop with CDC Places. Combine it with the census, and because you need both. Now, one cool thing about the CDC Places data, and kind of got off guard, is that you could use it on the zip code level, which is really, really important. So you can compare affluent communities and then communities that are disadvantaged. And you have all of these data sets. It's going to be a little work for you to do, but you can compare. And that's very important when you're forming your baseline data. Okay. So next slide, please. So again, combining these stories creates a compelling narrative. Qualitative data and quantitative data tells us that African Americans have higher rates of tobacco-related illnesses, but the qualitative data, like testimonies from community members, explains the why behind these numbers. Focus groups in African American communities often reveal the normalization of menthol tobacco use due to targeted marketing. Okay, so by integrating these stories with the data, you can build a stronger case, again, for advocacy and policy change. Next slide. So credibility in data collection starts with cultural relevance. Okay, this means designing those tools and methods that reflect the experiences and the context of the communities we serve. So examples of that include like photo voice projects, where community members can document their experience through photography, and you can have listening sessions conducted to trusted community spaces that can also add to that. We actually used photo voice as a tool to help us pass our smoke-free restaurant and bars here in North Carolina. Culturally tailored, here's a fact for you, culturally tailored cessation programs are 40% more effective than generic programs. And so this just shows you the power of culturally relevant approaches to creating impactful tobacco control methods. So communities aren't just, you just don't want your communities not to participate in the evaluation, or to, give the evaluation to a few people who happen to look like you. It's important to understand that another Black woman with a master's degree, who's working, who is not smoking, even though she looks like me and may have the same type of, she is not the person who I want to pass my evaluation on. If what I'm looking at is a tobacco prevention and control effort, I want to go to a smoker, someone who is living in the neighborhood, someone who is experiencing it. And I want to ask her, what is your experience? That is what, when I'm talking about how, next slide, please, how the community can drive the evaluation. Don't just look at the identity, look at the actual person, and actually making sure that you're selecting people who are co-creating, who are actually involved in the experience of what it is that you want your program to do. I cannot stress that enough. Make sure that they're engaged in every step, from designing your surveys to interpreting your findings. It's critically important. Community-driven evaluations are more likely to secure buy-in from tobacco control policymakers also. By centering the voices of those most effective, we ensure that our findings are relevant and we ensure that they're actionable. Okay, so if you're going to do a youth tobacco prevention program, get users, get youth who smoke actually to actually inform your youth tobacco prevention and control programs. Their perspective will often reveal emerging trends that might otherwise go unnoticed. Okay, so your next slide. So tobacco control advocacy has taught us that data and community engagement go hand in hand. So we have programs like No Menthol Sunday here at the center, which mobilizes faith-based organizations, showing the power of community-driven initiatives. Now, earlier on, I said look outside the church as well. I wasn't saying throw the church away. I wasn't. No. I'm not saying that. but I'm okay. So I just want to make sure that's clear. Okay. So, and I also hope that everybody is going to participate in No Menthol Sunday too this year. All right. So No Menthol Sunday, again, it mobilizes your faith-based organizations, and it does show the power of community-driven initiatives. These programs, or programs like these, it does rely on evaluation data to build the trust by demonstrating those tangible outcomes, such as reduction in tobacco use. And we do evaluate our No Menthol Sunday initiatives. And we do share the data. And we share that data transparently with communities, and hoping to foster collaboration and to empower stakeholders to advocate for sustainable change. You could share your data in one-pagers. You could share your data in newsletters. You could share your data in flyers. I mean, there's all kinds of really, really creative ways in which you could share your data. It does not have to be in a report. It could be, through pictures. It could be, on social media. There's lots of ways to do it. One thing that you might want to do is work with your young people and actually get youth to help you inform your data sharing methodologies, because young people are great about that kind of stuff. All right. So next slide, please. So one of the things I do want to share with you too is our copy of our health justice guide. I think it's important that as you're doing your work, and I'm putting the health justice guide also in the link, as you're doing your work, that you're framing it, like I said, in the historical, contextual, geographic, systemic. You're framing it in a way so that as you're working with people, people have a deep understanding of what you're working with. And that health justice guide will help you do that. That health justice guide walks you through the history of African Americans here in, actually, let me back up. It walks you through the history of African Americans. And we start with pre-colonial Africa, and it walks you through all the way into the current day. So that's really, really important. Download that guide from download the health justice guide from our website. But again, I want to say this, that culturally responsive evaluation is a pathway to health equity. And so by addressing systemic inequities and centering your community voice, we can create programs and policies that truly work. Programs combining policy advocacy with culturally relevant messages are twice as effective in reducing tobacco use in marginalized communities. The future of tobacco control lies in equity-driven approaches. So, next slide, please. What will you do to ensure evaluation is equitable and impactful in your community? And so as I close, I want to encourage each of you to reflect on how you can incorporate equity into your evaluation practices, whether it's engaging with a local initiative or adopting your culturally responsive methods. I mean, there's many ways that you can make a difference. After this, I'm including some tools with some steps in there that you can use. I've also included you're going to get a flyer from me on how to use the Health Justice Guide, how you can use it, in your community. I do invite all of you to connect with me on LinkedIn. I'd love to connect with you all on LinkedIn. Please do that. And thank you very much.
Thank you, ladies. Thank you, everyone, for everyone that has spoke. We are now going into our Q&A. For the panelists, I will be asking you a few questions. I'm gonna give the audience a chance to put their questions in the Q&A chat, and then we'll answer them live. I'll make the first question for anyone to answer. The first question is, what are some of the biggest barriers you've encountered when trying to incorporate equity into evaluation practices? How have you overcame them?
That's a good one. One of our biggest barriers, believe it or not, in incorporating equity in our practice is actually pulling the right people at the table. It's not easy finding people that reflect your community and pull them to the table. I don't want to make light of that. That is something that we struggle with.
I'm gonna say the biggest challenge, and it still remains a challenge, I think because our cultural dictates, and then supremacy culture has a sense of urgency, but it's time. There's always this timeline. You need to have your data in, especially around funders. Evaluation has to be in at this particular point. And so if we're really going to give true justice to the process and we're really centering the stakeholders involved in evaluation, then we should take those time parameters off of it and fully allow participants and create multiple and multiple and multiple opportunities in order for everyone to be able to participate. And so it's actually a challenge that is challenging to overcome because you've got these deadlines, the funders, we need to have this report in at this time. And so you try to do as much of a service as possible within that time frame. But in reality, would rather not even have and be limited to that time to really give it full justice.
Ditto. Yes, I think there's a distrust. Working in Durham, North Carolina, I realized there was a huge distrust because of extraction of data that always happened, and there was never anything put back out. So yes, Sterling, what you just said, and Dr. Davis, yes, white supremacy culture is how we operate within our organizations, and that is part of the problem. We are part of the problem, and we're not ready to name that yet. But yeah, that time thing, like I might be, on time, somebody else in time. We look at time differently, and we have whole policies around time, and that's problematic when you think about cultural Also, where we put our time and money is based on what we prioritize. So when I showed y'all the example, that was hard. I mean, I got in a lot of trouble. Like, we had to slow down, we had to use more money because we fed people and we had childcare. We had to spend more money on where we were going because we wanted to go to intentional places and get intention. Like, it took time and it took money. And people will spend all this money in their organizations around personality assessments, which don't get us anywhere. I can't tell you how many of those we've done, but we do not want to talk about the inequities and how to address those, and we don't want to spend money on those things. So it always comes down to what we prioritize. So pay attention. And then you leverage, I would say I used to have to leverage things. Well, this is what we're supposed to be doing. This is what the CDC said, and then I would try to call people in. But again, it got me in trouble. But everything y'all said it's hard because there is a distrust there, because there's a historical context there. But we got to keep pushing, y'all.
This is all true, very true statements, very true statements. We have a question to chat, and it comes from Christelle Stipe, and she asks, do you have recommendations, tips, guidelines on how community groups and nonprofits can continue equity work and focus evaluation in the current political climate? Organizations that usually get government dollars.
Actually, I do. There's a couple of things that I'd like to say. First of all, one thing is to really, first of all, there are two things to keep in mind. Many of these executive orders, and I know what I'm about to say is probably not going to be popular right now, but many of these executive orders don't have any weight, and they're also to really upset people. And without actually having anything tied to them. And so one of the things I cannot encourage you enough is to work with your legal department to find out if you are in violation of the orders. Most of the orders have to deal with employment. They have to deal with HR rules. They are not around some of the disparity services that we're offering on a daily basis. So a lot of times paying attention to the headline in the news is taking you off course, which is part of that's part of the strategy. So, but in the meantime, another thing that I would tell you to do is to focus your work in the numbers, in the data. Focus your work, go to CDC places and look at that. Look at your income, look at your health, different health indicators. Focus your work there. Focus your work not just in one community, focus your work on multiple communities. So as you're doing your disaggregation of data, you could do your disaggregation of African American data, but you can also show Native American, you can also show Asian, and then white data. My thing is, like, I think we've got to kind of outthink them a little bit. And part of it too is, if you don't want to talk about race, we don't need to talk about race. But I tell you what we do need to talk about. We need to talk about zip codes, and we need to talk about economics. And guess what? Zip codes, economics, your history, your geography, that does equal race. So if you're not gonna talk about me because I'm Black, oh well, let's talk about, where Black people live. Let's talk about the economics or the economic infusion or cash that comes into Black neighborhoods. Let's talk about that. And let's use the data that they want to use for things like opportunity zones. Go out there and look at that. Look at that income data on that. Go out and look at your Zillow, or go out and look at your realtor.com data. Pull that information and use it in your health data. They may not want to talk about equity. And fine, we don't need to talk about equity. Well, let's talk your language. So I'm saying go out and learn the language, learn the lingo, and then give it back and say, okay, well, if you don't want to talk about this, then how are we going to raise the condition of this community versus this community so that we're all doing well? So that is what I would tell you. And one more thing, and I'm sorry, and I'll stop because I know I'm going long here, but diversify your funding. Whatever you do, please diversify your funding. Don't count on any one funding source. Don't just count on federal money. Look at state money. Look at if you do federal money, and look at also private philanthropies. Look at other types of memberships. Just just really think outside the box with some with your funding. Don't put all your eggs in one basket.
Anyone else want to chime in? No? Okay. I definitely agree with that statement. I would definitely say other sources of funding, just based off of some of the stuff that is out there, you just never know what you're getting into. And then a lot of times we'll get funding because they throw the money at us, but we don't read the fine print of some other things that may come up and we're thinking we're doing good work and something else happens. We'll go to the next question. We have Isaac Finter. The question is, I work for a new health equity agency in New Orleans. What are the best ways to engage with, learn from, and support organizations in the community?
I'll jump in, and so before I do that, I want to add some other pieces. So I love what Sterling said. I understand because I've been part of the discourse and the conversation around sort of what's happening, and a lot have been done in the few weeks of the month has the year has started, and I've been watching the Great Migration series that PBS is put out. And what I've been reminded of is we've been through this before. It looked different. We've been through this before. And I think right now is we're taking time to process things that are happening, getting to articulate our emotions, and then we're going to move into action. And similar to what Sterling is saying, we're going to find what it is to be able to leverage. Because my career goes back to the point where we weren't even talking about health equity. Health equity wasn't even a conversation that we were having, right? The most we could talk about was cultural context, cultural competency, but even talk about health equity, we weren't there. And so now we've got somebody who we want to retract, and that's okay because we can come up with another terminology to be able to continue to use and to move forward. And so, yes, express yourselves. Yes, go through the process of the emotions, but then also realize we've been through this before. Let's take our tool set, let's take those strategies, and let's continue to move forward. Isaac, thank you for your question. And I would say, being in New Orleans, you understand that we are about community. And so the first thing is to enter a community and enter it as a partner, as opposed to an exploiter, right? And I see, been through this work a lot of times. If you enter and you show up looking exploratory, like you're gonna be exploiting somebody, they're gonna shut you down. So there's not gonna be much. That's not gonna be far you're gonna get if you don't approach it from a true partnership and a true support. And that takes time, and that takes a lot of time to build those relationships. And so that's gonna be difficult to kind of quantify. Oh, what were you doing with your time? I was building relationships. So the outcomes for that is going to be delayed, but the effort towards that and an investment towards that is going to be necessary. So sit with them, learn from them, engage, have those conversations. I want to have a one-on-one with you. This is the work that we're doing. Love to hear about the work that you are doing. How can we work? Very easy, very fundamental. However, it's also going to take time. Also show up. New Orleans is a community where you have to be in front. People know how sick you are based on your presence. And so if you are not there and you're not present, they don't think that you are as committed. So show up, and then you'll see and you understand those partnerships, and they will continue on further.
Great. Thank you, Dr. Davis. All right, we're gonna go to our next question. It's from Jenny Dickherber, and it's, how do you navigate the validity of low response rates, as in small group feedback is still important?
You want me to jump in? I can jump in too. So, all right. So we talk about response rates and validity when you're talking about quantitative data, right? And so that is important depending upon the type of analysis that you're doing. Reasons why cultural responsive evaluation focuses on qualitative data is because we want to set the voices of those who have the lived experiences. And in qualitative data, numbers are not as important. What's more important is saturation and the consistency of the messaging, and also the trends that are happening in terms of the analysis that comes from that. So I did my whole dissertation, a study on 5 participants. It was phenomenological. And so there was rich data happen because I used 5 people to go deep. And so there was strength in the results of that, and because it was qualitative in nature. And so low response rates, um, you know, I wouldn't necessarily be so concerned about that, because those who respond, you can actually go deep and get a whole lot in terms of depth as opposed to a large number. But happy to talk more offline about that project in particular, Jenny. I'm gonna put my LinkedIn in the chat as well so that we can connect.
I also want to talk a little bit about that too. Just to say something that I think is really important. It's about relationships too. So, making sure that you're getting out there in the community, that you're really talking to a variety of different people, and that you're forming those relationships, that you're not just going in like 1 or 2 times and asking for something, but I mean, you're there, you're at the coffee shop, you're at if there's no coffee shop, you're there where people are. And that will help with your response rate. Being there, if people recognize you, if they know who you are, that will help a lot.
All right, and we have one more question in the chat from Van Lee. What are data collection and dissemination methods that can empower communities and organizations to drive health policy change in their localities?
Y'all, I'm being quiet because I took up enough space. So I'm just moving back. And everything y'all are saying is on point. I would just reiterate it. So
I don't want to dominate response either, so I'm being quiet.
That's fine. That's why I was being quiet.
So we don't need to be quiet anymore. All right,
I don't need to be quiet anymore. Go ahead. Go ahead. It's interesting. That's an interesting question because, those data collection and dissemination methods, I would say actually are unique to your community. It really depends on your community. Again, each of our communities are different. And, a good example of that is like here in North Carolina, we joke about we this is a big joke here, that North Carolina, we have a civil war, right? In North Carolina, half of the state is like red sauce and the other half is vinegar. And Janet, you know exactly what I'm talking about. If you have barbecue, you're gonna, if you're in Eastern North Carolina, you better not talk about red sauce. If you're in the mountains, you better not talk about vinegar. And it's so interesting how different we are. And so, your data collection methods And your dissemination methods really need to be based upon, if you're going to collect information on vinegar, or if you're going to collect information on your red sauce, it needs to be reflective of the community. And that needs to be informed by your history, the culture, the context, and also the geography. And let me tell you why I say geography. I'm saying geography because, and you've heard this from all the speakers in different kind of ways, that geography is critical, because if you live on the coast, your whole life is going to be framed by the weather. It's going to be framed by all kinds of other geographical features. But if you live in the mountains, it's going to be framed by different things. You're going to have issues with snow. You're going to have other kinds of issues. And those geographic issues actually inform livelihoods, a lot of the ways how we all live. So, here in North Carolina, it's really interesting. If you're on the coast, you're hit by hurricanes a lot harder than you are in the mountains. And that was true until the last Hurricane Helene, which was a game changer. But, typically so however you ask those questions, however you collect that data, you got to kind of keep that in mind. So again, it's really community specific. We call it HCCG at the center: history, culture, context, and geography. And if you get the book off of the website, you don't have to pay for it. It's a free download. I just have a printed copy, so it's a free download. So I'm not telling you to buy it. If you get the book from the website, we do outline that HCCG methodology, and we actually tell you how to use it. And so this is based on the community development model. So
I love what Sterling said. Culture is so important. Culture is so important. And so I would say leverage the ways in which um, people in that area, and what's their culture like? What do they enjoy? It's, opened up to talk about how much um, here in New Orleans was into food. And Sterling, we barbecue shrimp, and it don't have anything to do with with vinegar uh, or tomatoes at all. So it's a whole nother way that we describe barbecue shrimp, because it's a different thing based on our culture. And so leverage that experience. If you pay attention to a lot of the campaigns that we see here now, it's leveraging culture. So during the political season, the Get Out to Vote campaigns was about second lining to the poll. And there was an actual second line that people had brass bands that led people to from where a meeting locale to go early vote. That was part of the culture, right? There's a commercial going on right now about a big freedom and about HIV prevention and the prevention rates. And so here is we're leveraging culture. Um, in New Orleans, Big Frida is a product of New Orleans, and New Orleans has embraced it, and so has the rest of the world. And so, and the title says something about bounce to whatever. And so Big Frida is a queen of bounce music in New Orleans. And so leveraging the culture to be able to uh, share information about health statistics and reducing the stigma around HIV and AIDS and prevention. And so all those things are going to be, uh, really useful in order to be able to do that.
And then these responses never thought of the context of livelihood as a type of cultural responsiveness. Thank you, Ms. Sterling, and great response from all. Thank you. All right, and that's all the questions in the chat. We are at 12:28, so I'm going to wrap us up real quick. I just want to say in conclusion, we learned a lot of different areas of evaluation, how to connect with our communities, how to tell the stories of our communities, and then not only tell their story, but also help the community to put them in the forefront. And as Jana said, we could bring them to the table, but we don't have the stuff for them to eat at the table. So that's a very important connection that I'm definitely going to steal from you as well. But I do appreciate the topic today and the conversation that we had. I want to thank our speakers today for being a part of this very important webinar. Again, happy Black History Month to everyone. A follow-up email after this webinar will come to all participants. It will have the recording that will live on our YouTube channel, all the resources, the LinkedIn, the different links and resources that were mentioned in today's webinar will also be on the follow-up email. If you do not receive a follow-up email or you want to share within your department or organization, it will live on the tobaccofreeliving.com/empower, which is our Empowering People Community Series webpage, and they will also be housed on our website as well, along with all of our speakers' contact information and the resources that they provided today. Again, thank you all for joining today. Thank you again, speakers and panelists for speaking today, and everyone have a good Thursday. And again, happy Black History Month. Y'all have a good day.